What is a sinus lift? There are a number of variables that we look for when we're planning for implants. The most important aspects, especially at the back of the mouth, is the bone width and bone height. At the back of the mouth, in the upper jaw, there are sinuses nearby, and what they are is essentially cavities in the face. Everyone's got them, they're perfectly healthy and normal. But when teeth come out, often sinuses drop down, and when we go to place the implant ends up sticking into the sinus. We don't want this situation because this sets the implant up for potential problems down the track. So what we do first is we graft the sinuses. In other words, we put some bone inside the sinuses to allow more room for this implant, or more height of bone, in other words. It's a very simple procedure. It's usually done at the practice. Some people have it under general anaesthetic, some under local anaesthetic. There is about a 5 months wait for the sinus lift to mature before we can go and place implants. So to be able to know whether you need a sinus lift or not, I need to have a look at your scans and determine what is the appropriate width and length of an implant. If there is a bone deficiency as far as width or height is concerned, width can be grafted with a different type of a procedure, but to create more height of bone, you would need to have a sinus lift. A sinus lift would cost very similar to other forms of grafts, depending on what's involved and how much bone we need to use, but probably anywhere from $2,000 to $3,500 is what an average sinus lift would cost. It's not a painful procedure. It's probably one of the easiest tolerated procedures. Most patients, when they return to have their stitches removed, they say that there is hardly any discomfort with it, surprisingly. People are often concerned about this procedure because it sounds quite involved, but being inside the sinus, it's actually protected from the oral environment, and not a lot of pressure builds up as a result, and it heals very successfully. It's actually one of the most successful forms of grafting, and very, very easily tolerated, and the success rates are extremely high. Sinus lift can be done both simultaneously with implant placement and at a separate time, depending on your requirements. If we need to generate a lot of bone, then it's probably best to do the sinus lift first, then wait 5 months and come back and place the implant. However, if there is somewhat adequate bone there to anchor the implant, then we can often consider placing the implant and doing the sinus lift at the same time, which saves you time.